The First World War brought conflict and therefore injuries on an unprecedented scale. 2 million British soldiers were treated by medical services, as well as millions of soldiers and civilians from other countries. However, it was not just the number of wounded people that was unprecedented. The types of wounds and associated problems were new as well. An estimated 58% of wounds were caused by highly explosive shells. This meant blast injuries, but also huge numbers of injuries caused by shrapnel penetrating deep into the body. Most other injuries were caused by bullets fired by machine guns or rifles. Bullets damaged organs and fractured bones. Almost all these types of injury led to blood loss and the risk of shock. The land on which most British soldiers fought on the Western Front was contaminated with gas gangrene and tetanus. These bacteria easily entered the bodies of the wounded, causing infection. The war was fought in trenches, meaning that soldiers' heads were the most exposed parts of their bodies. This meant huge numbers of injuries to the brain, head, and face. The types of injury and the huge numbers of people suffering from them led to improvements in many areas of medicine and surgery. However, the First World War did not only bring positive change. Around 14,000 doctors were taken from their usual posts to care for the wounded soldiers, either overseas or in military hospitals in Britain. This left civilians in Britain with reduced access to medical care. Almost all medical resources were plowed into meeting the needs of wounded soldiers. This meant that medical research into non-war related illnesses and other medical conditions almost completely stopped.